If you don't want to be recorded, please keep your video turned off and your device on mute, or if you're really worried, please leave the meeting. And if you have any questions, you can put them in the chat. You can email them to me as usual. So here's the agenda, pretty short and snappy this week. We've got our usual data update from Anna Hartley. We've got Helen Brailsford, who is going to be giving us a short update on the Provent trial. And we have Sue from the Integrated Care Partnership talking about the new branding. So without further ado, over to you, Anna.
Yeah, so it's just the usual slides, and actually there isn't a huge there's not a huge difference in what's happening. We're basically seeing that rate far too much higher than we'd like, and sort of staying fairly steady. John, just go to the next slide, Craig. I think you can see that so currently we're looking at like 500,000, but it seems to move around between 450 and 500 every week. And if you just go to the next slide, Tracy, we're putting a new slide this week. So this slide shows you the picture across West Yorkshire. You can see that we more or less track our West Yorkshire neighbours, but then you can see Caldwell have had this real sort of jump hit at that where they've got those much higher rates. And Wakefield are tracking just a tiny bit above on that red line. Caldwell have introduced those school measures, which is exactly what we've done as well. And we've used some additional school measures to take place from next. So it'll be interesting to see if that what that does with our rates, and whether that makes any difference to our rates, because we know obviously our highest case rate are in that secondary school age population. Next slide, please, Tracy. So again, we always show you this because it's just quite interesting around positivity. And you can see that Wakefield is kind of, again, tracking that West Yorkshire average, so way higher than we'd want. So, 12.5% positivity. That just shows that we've got too many cases. And then when you look at the right-hand side of the screen, you can see how that positivity rate changes according to what age group we're looking at. And that again gives you a good idea of the rates within that group. So you can see your 11 to 16 age, which is that one right at the top, is extremely high. So for every 2 tests, those PCR tests that get sent off, just well between about around half, a bit lower than half of those tests will come back positive. So that is crazy when you think that, about 6 months ago we were looking at positivity rates of 1 or 2%. Next slide, please, Tracy. So again, this is the slide that we show you every time, sometimes called the slide of doom. It's actually looking a little bit better this week. We've got a few of those lighter colours coming in. You can see that again, that where our heart rates are very high at that 11 to 16 age group, so 2,000 per 100,000. That's why we've introduced those 2 additional measures into schools around household contacts, potentially staying off for a few days to get a PCR test, and also looking at reintroducing face coverings as well. And also the other thing just to note is that 80 plus age and that 60 plus age, and you can see that those numbers are getting a lot higher. Hopefully the booster campaign will help with that, but that is, again, those are we worry, that's the age group that we particularly worry about, so that is not something that we want to see. Next slide, please. So again, just quite interesting to just see the case rates by different ages. So these are, we're interested in school age because they're so high. We're interested in over 60s because those are the rates that we worry about. You can see that orange line on the bottom is that over 60s age range, and was very low, tracking right along the bottom, those lovely days where we had 0 cases in that population. And then you can see that as that rate started to rise, that's probably less likely to do with anything to do with the vaccination at this stage, and much more to do with the fact that when rates are so widespread within the population, you just get that spread, and whereas back in sort of months ago, we just had a much lower case rates overall. So that's kind of what we look at, and you can see that school age really, that 11 to 16, really way above those other age ranges. But we also sometimes then see that those 60, that age obviously mixes with parents, mixes with grandparents, and then you can see that spread happening as well. Next slide, please. So it's just quite interesting to look at the school cases, and you can see that they've been pretty high, very high since all the way through this term. We might see that drop a little bit because of half term. It creates a bit of a fire break, but and also the vaccination programme that's happening, we may start to see that impact, but at the moment it is extremely high. And obviously that, I think my hero, well, there are many heroes, but one of my heroes definitely have been head teachers, because they've just had to take on this whole new role around COVID, and for that's off, that then can have an impact as well on the ability to sort of run that and stuff. So it is very, very challenging for them. Next slide, please. So again, this slide just gives you a bit of a sense of what's happening across the districts, and you can see that it's looking a bit better than it was a couple of weeks ago, with those areas of blue, slightly lower rates. Until we start seeing that real genuine reduction down, I'm a bit cynical, because I think we just get those fluctuations in numbers on a weekly basis. But we'll see how that looks next week. Next slide, please, Tracy. And then just hospital admissions. So again, you can see those have sort of steadily gone up, and that really reflects the older age range having COVID. And for most of those people, double vaccination will mean that they don't go to hospital, and although they'll have COVID, it won't be anything like as bad. But unfortunately, some people will end up being hospitalised, and there is still, of course, a percentage of the population that haven't had the vaccination, so they are more at risk. And that is a real challenge. So Wakefield residents, 48 there, and 35, I think, non-Wakefield residents. But obviously, when we're thinking about Mid Yorkshire hospitals, which is, where those residents are from is irrelevant, because it puts pressure on the hospital. Next slide, please. And again, deaths. So again, nothing like what we were seeing pre-vaccination, but those deaths remain sort of fairly steady, a lot, much higher than we would like. I think that might be my last slide there, Tracy. Oh no, oh yeah, I just thought this was interesting. We don't normally show you this slide, but I just thought this was quite an interesting one for you to see. And this is Yorkshire and Humber, and these are ED attendances for acute respiratory infection. So what the dark sort of the maroon line is the 2020 to 21, and then there's a baseline underneath. So this is sort of last year's data, but what you can see is those higher rates, and I'm sure, and that will also we'll continue to see that, I expect, through to next year as well. And that again, that puts huge pressures on emergency departments or A&Es, and you can see quite clearly from that graph that it has been much higher, and also remained high through the summer, because often those will drop right down through the summer, but we haven't seen that. So again, staff who might get a bit of respite during the summer, things were a bit quieter, that we've not seen that this summer. So it is quite a difficult context going into winter. Next slide, please. Yeah, so that's all from me there.
Thank you very much, Anna. Does anyone have any questions for Anna around the data? We have got some questions further down in the slide set, Anna, that you'll probably want to answer, but does anyone have anything? I'm not sure if I can see anything in the chat. Let's have a look. Nothing in the chat as yet, so if you do have a question, please do put your hand up or shout out or put something in the chat, and we'll do our best to answer. So thank you very much, Anna. We've now got Helen, who's going to give us a verbal update on the Provent trial.
Okay, thank you very much. Yeah, I'm Helen Brailsford. I'm the Corporate Performance and Intelligence Manager here at Wakefield Council, and I've had the pleasure of working with colleagues on the COVID antibody study trial. So I'm just going to take you through some relevant points, give you a little bit of an update. So thank you very much for inviting us back. So just to remind colleagues, Wakefield was successful in securing a commercial monoclonal antibody study trial, and we were focusing on frontline workers most at risk of catching COVID-19, those over 60s living in retirement villages or supported living accommodation, and over 60s who were living alone. We commenced the trial on Saturday, the 21st of November last year, during which we achieved first global patient, which was obviously a real acknowledgement of the hard work and the true partnership model that we had in place here in the Wakefield district. The first global patient was an ICU nurse that worked at Pinderfields Hospital, and her colleague was a second patient as well. So that demonstrated the fantastic commitment, obviously, of our NHS colleagues around sort of acting as exemplars to our local residents and communities, sort of encouraging them, obviously, to come forward to take part in the trial. It also attracted outstanding media coverage for Wakefield, so placing us on the map, really. And two of our medics undertook interviews with such as Sky News, Look North and Calendar. And our story was also sort of covered in Croatia, which was absolutely fantastic for us as a place. Additionally, we sort of saw interest as well from health trade publications, which led on to us being put forward for an award, which obviously I will sort of come on to. We were originally anticipating that we would recruit around 200 plus people to the study. However, it's not been an easy trial, and we have faced quite a number of challenges. And a major one for us obviously was the 3 vaccinations that came on stream, which was fantastic obviously around the fight against COVID, but obviously impacted on our ability to be able to recruit. So we were sort of set on the journey obviously of trying to bring people forward to take part in the trial, but obviously the vaccinations came on stream at the same time. So we managed to recruit 55 patients, and 47 are still actively involved in the trial, and they are part of now what we call the follow-up process, which will run till June 2022. There's quite a lot obviously of data input requirements around sort of the information that we have to provide, which obviously is sort of quite challenging, and as you'd expect obviously it's a very, very robust process. However, sort of through our commitment and dedication, the sponsor, obviously, which is AstraZeneca, has stated that Wakefield has been the best site globally for our practices and data reporting. So we've been considered as being best in class, which same again is absolutely phenomenal for Wakefield Place, sort of putting us on the map. Here in Wakefield, where a patient sort of requested to be unblinded, obviously we have obviously been respectful to their request, and obviously we have sort of given them the information in terms of whether they were actually given the placebo or the antibody medication. So obviously then where people have chosen that, they have obviously gone forward to be vaccinated, so obviously to have had one of the 3 vaccinations that were on stream at that particular time. So globally, all the recruitment finished in March, and as part of the phase 3 of the trial, there's been a rigorous challenge of the results, and completion of various sort of approval processes. And we're delighted obviously to sort of advise that Wakefield obviously played its role and its part in contributing to the development of a new monoclonal antibody treatment, which obviously supports the fight against COVID-19. So this is specifically for people that will probably have a poor immune system, and whereas you yourselves obviously who have been vaccinated, where you would actually create your own antibodies, this is for people that won't sort of do that. So we're absolutely delighted that Wakefield's played its part in being able to sort of support people that have got poor immune systems. I think a key success for Wakefield has been obviously the partnership model as well of the trial. It's been acknowledged obviously as an exemplar of good practice by the National Institute for Health Research, because it's absolutely brought together partners across the Wakefield place. So some of the other models up and down the country have been sort of focused around sort of hospitals. This has been a true partnership approach and model for Wakefield, which I'm very, very proud of, obviously from a Wakefield Council perspective. So much so, we've actually supported colleagues in Doncaster and Sheffield who obviously at that time were looking at setting up their own trial, and were wanting to replicate the Wakefield model. So as I sort of touched on earlier as well, we got quite a lot of interest obviously from health sort of journals, which led us obviously to put in for a Pharma Times International Clinical Research Award, and it was brilliant that we won the award on the 23rd of September at a prestigious ceremony in London. So we won the Clinical Research Team of the Year award, which is obviously fantastic. So what we're doing now is sort of work is ongoing, obviously, to explore our capacity and capability at place to be able to secure sort of more multi-centred health and wellbeing trials for Wakefield, which obviously would sort of support us to be able to raise skill levels within the district and potentially bring in new employment opportunities and contribute to that local economy. So a real success story for Wakefield, and us playing our part in being able to support people that wouldn't naturally be able to develop their own sort of antibodies. So that was the focus of the trial. So I'll pause there. And obviously I've got sort of 10 minutes, haven't I? It's whether anybody's sort of got any questions that they'd like to raise.
Wow. Thank you very much for that update, Helen. That's awesome news. I didn't know, first of all, that it was specifically for people with poor immunity, which is fantastic. And I didn't know that you'd won the award. So that's a double bonus. Excellent. Well done.
We're very proud. We're very proud of Wakefield, and we're proud, obviously, of the role that our communities and people that are on the call today have obviously been able to share that message and have promoted the trial and the good work of what we've been trying to do and to keep our people safe.
Yeah, fabulous. Thank you very much. I can't see anything in the chat. I don't know if anybody else can, but does anybody have any questions for Helen? Doesn't look like it, but as ever, if you do think about something afterwards, or if you've got any comments, please do email them through to us at ccc@wakefield.gov.uk, and we'll do our best to pass them on and answer. Thank you ever so much, Helen.
Thank you. Take care, everybody.
Bye. Thank you. Wow. And we've now got Sue, who's going to talk about developing a visual identity for the Wakefield Health and Care Partnership. Over to you, Sue.
Thank you, Tracy. I have noticed in the chat, though, I know you said you can't always see it, that George says he has breaking news. So I'm quite happy to let George go first. I don't want to keep everyone in anticipation.
Oh, thank you very much. Thanks for spotting that. George, would you like to go next?
Sorry, trying to just get my camera working and get off mute there. Sorry. So I've not had time to. It's just come through not so long ago, so I've not had time to put a slide together on this. Let me just get to the release. So 12 to 15-year-olds in the Wakefield district now have additional opportunities to receive the COVID-19 vaccine as quickly as possible. What's happening is that parents and guardians are going to be able to book using the NHS National Booking Service, and appointments are also available at pharmacies to you vaccination clinics, at Morrison's on Dewsbury Road in Wakefield, and Pontefract Squash and Leisure Club.
That's excellent. Thank you very much. George, would you mind doing me a favour, please, and just jotting those locations down for me on an email, and then I can circulate them to all of our champions, make sure that we get the right places.
I will do. Yeah. No problem.
And I think that's the first time we've had a breaking news on our COVID champions meeting. So fabulous. Thank you very much.
No problem. Okay.
Thank you, George. So back to Sue.
Thank you, Tracy. Thank you, George. If you could move on to our next slide, please, Tracy. So what I've come to talk to you about today is Wakefield Health and Care Partnership, which is a partnership of NHS organisations, Wakefield Council, Health Watch Wakefield, Wakefield College, and a range of voluntary sector providers working together to improve health and wellbeing for the local people across Wakefield district. So the work that you do as COVID champions is very much a part of that. And we're one of 5 places, so Wakefield is one of 5 places which is included in a wider partnership across West Yorkshire, coming together to improve the health and wellbeing of local people and looking what we can do to support that. And just to give you a little bit of context, there is a health and care bill, which I believe that you have had some headlines about before. So this is just to remind us. It's going through the system at the moment. We expect it to be introduced from the 1st of April. And the legal responsibility for NHS health services will sit with West Yorkshire. but most of the local decisions and the delivery all around health and social care for West Yorkshire will sit with a Wakefield partnership. Next slide, please, Tracy. So these are just some examples of the work that's currently being done by the partnership, the Covid-19 programme, as we've put on, which obviously has been a huge part of the last 18 months. Work on from Connecting Care Hubs, which brings together a number of providers to provide person-centred coordinated care. That's a bit of a posh name for putting the patient first, making sure that we work together to provide that person's needs so it's not too fragmented between different services. And then public awareness campaigns such as the recent Root Out Racism campaign that you might have seen, staff events which cut across the various organisations. We recently held an Equality and Diversity Summit. Next slide, please, Tracy. So for that organisation, we've been working together for a while, but we haven't had a proper organisational identity. The feeling is that we should call ourselves Wakefield Health and Care Partnership because that aligns the name with the wider West Yorkshire partnership that we're a thought of. And it demonstrates that it's about both health and social care issues, so it's wider than just the NHS. An identity needs to be simple. It should be something that's easy to memorise, and it should be meaningful, so it should explain to you what the purpose of the partnership is. It should provide a visual representation, and it needs to be flexible because it gets used in lots of different ways. So I find that the simple relates to that. If you keep it simple, it helps you to use it in different ways rather than something that's overly complicated. It obviously includes a logo, but it can include more than that. It can be a style that works for your different documents. That can be a colour palette or a particular design. And it can also include a strapline if it's felt that more explanation is needed about what it's all about. It doesn't have to include a strapline, but that's an option for us if we feel that we need to explain a little bit more. Next slide, please, Tracy. So what I've done is I've brought together a few examples of what has happened elsewhere in the country. These are organisations covering different geographical areas to us, but doing similar work, and how they've branded themselves, just to get some feedback from you, both as members of the system, because COVID, as I've explained, is very much part of the system, and also as members of the public as to what approach you think we should take for Wakefield. So the first example is to go down the place route. So it demonstrates which part of the country we're talking about, who we're working for. You can see Sussex and South Lancashire have done that in different ways. And then on the right, you can see the shape that we have for Wakefield. So if we were to go down that route, that's what our district looks like when it's represented as a geographical shape. Next slide, please, Tracy. Another option is to reflect. I tried to divide these out into people and then partnerships, but actually there's so much overlap, it was hard to do that. And some of these examples might say different things to you than they do to me. It's all in the eye of the beholder, really, isn't it? But what I see here is 5 different logos, all with a very different look and feel, but all of which I can see people in them, and I can also see partnership working in them. I can see, you know, the example of different people and organisations coming together. Next slide, please, Tracy. And then this example is emphasising the healthy lifestyle, which is what we're all about. We're all about improving people's health and well-being. And there's crossover. The first one, County Durham, could also have gone on the partnership place. There's Renfrewshire, which for me actually shows a sunny day, healthy lifestyle and exercise. And then underneath, the other two are quite a different approach because they've got more of a texty approach. They've almost included a strapline into the logo examples. So happy to go backwards and forwards across those 3 slides, but these were the 3 that I wanted to have a look at and see if you have a view as to which sort of style we should take for Wakefield. I'm going to be talking to a couple of other groups as well, and once we've spoken to everyone, we'll then develop some design options which we'll share with you with a survey monkey for people to express their preference, and then that will go to the board for final approval. So this is very much the development stage. It's giving you a chance to get in at the start to express a view on which approach you think we should take. Appreciate it's a lot to take in straight off.
Thank you. So we've got a couple of things in the chat already.
So a couple of people saying they like the people and partnership approach.
That's right, yeah.
Angus, okay.
Yeah. Thank you, Anna, I've got your message.
Thank you very much for that. Just one more slide as well, please, Tracy. I did mention at the start that it can also include a strapline. It doesn't have to, but it can. And here are some, not cast in stone by any means, but some examples of the sorts of things that we could consider. So improving health and well-being, working together for local health, healthy lives for everyone. You may feel that this has already been captured by the organisational name, Wakefield Health and Care Partnership, or you may feel that that needs a bit more explanation as to where it is about. And what I've included at the bottom there are just some keywords that we might want to consider including if it's felt that we do need a strapline, in which case when we share the design options, we'll also share some examples of straplines that people might want to express a preference over.
Thank you, Sue. I've got a comment actually, and I'm sometimes put Wakefield on things, and people are quick to remind me it's Wakefield district, because people feel that Wakefield is a whole district, and sometimes just the word Wakefield does sound a little bit divisive, as though it's just the town centre.
If we chose to go down the place route for the design, that would address that.
Yes.
Straplines another place that we can address it. Or also the shall we call it the house style? So you have your logo, but then you have a design style that carries through all of your documents. So it might be that we're able to address that within that. West Yorkshire, I haven't got this on the slides, but West Yorkshire, who is our wider regional organisation, has like a skyline that includes key landmarks from across the region. Appreciate it's a lot to take in, and I know that we're nearly at time. There's a couple of questions to run through. I have just on the last slide included my email address. You also have the Community Champions email address, and I'll take a note of the comments that people have posted in the chat. Thank you for that. If there's anything else that you'd that you think of after the meeting that you'd like to say, then please do let me know. And the other thing just to share is that we are considering a website as well for the partnership. So if it's okay, at the appropriate time, I'd like to come back and get your views on that as well, what that should include and what might encourage you to use it.
That's lovely, thank you. We've got
Amanda's suggestion of a strapline. Thank you for that, Amanda.
Yeah, that's a good one. Nice one, Amanda. Thank you very much. So you're quite right, we've not got an awful lot of time, so please do send your comments and questions in. I'm sure we've not heard the last, and we'll have more opportunities to be involved. But we did have some questions. The first one was from a choir where 11 members tested positive after rehearsal 2 weeks ago. Really sorry to hear about that, that's bad news. And the choir had taken the recommended COVID prevention precautions for choirs. So they're asking, what precautions should a choir take for a rehearsal over and above a similar number meeting to discuss business, etc.? Is there a limit to numbers that can meet?
I can take this if you like.
Thank you.
So I suppose there's the kind of national guidance, and there's also perhaps applying that to your local situation as well. So unfortunately, we know that choirs are quite high risk, because obviously when you sing, you blow out kind of more virus than you would if you weren't, and that's a real shame, because I for one love singing. I'm sure lots of us love singing, and it's really good for mental health and well-being, etc. So I think, given our incredibly high rates as well, I might just kind of think a bit about the people that are attending. Are any particularly vulnerable? Would any be particularly at risk if they caught COVID? And if so, maybe think about other ways that they could join in. And I know that's really, really difficult, whether that be doing some of that virtually or whatever. I think you can lateral flow your members prior to coming, which there's a question on this. The third question is on this. Lateral flow tests pick up around 50% of people who have got positive COVID. So when I had COVID a few weeks ago, I had a negative lateral flow test the very same day I got a positive PCR. So they're not the be all and end all, but they do pick up some COVID. It's an extra layer of protection. I think it's keeping a really close eye on the numbers as well. So just seeing if our numbers go up more, or our numbers go up in the age group of the choir, that maybe consider meeting virtually for a while could be something you would do. We can Some of the more specifics, I think we can take that offline and we can talk to colleagues who can kind of, because obviously every situation is slightly different. But I think the sort of take home message is just because you can do doesn't necessarily mean you need to do. And it may be about thinking about your specific circumstances and adding in a little bit of extra caution, particularly at the moment when we've got such high rates and things like if people haven't had their booster and their vaccination was more than 6 months ago, maybe thinking perhaps not attending or something like that. And this is absolute advice. It is not, I cannot tell you to do this, and you will have to take your own view. So it may be that you feel that the mental health and wellbeing benefits far outweigh the risks, in which case that's a decision for you and your group. But I think those things are just worth thinking about. The other thing I think is worth thinking about is just what would you, if for some reason your group couldn't meet, ensuring that there's other mechanisms, and I know there are those mechanisms in place from the last 18 months where you can meet virtually, so that you've got a kind of backup plan if for any reason you couldn't meet face to face. So, and then the bottom question is around the positive PCR test and having COVID. So I think this is something we probably need to take away and deal with specifically with the specific team it would involve. The challenge around any test is it's only accurate on the day and time that you take it. So with the PCR test, if you take it on a Saturday but you contract COVID on a Sunday, you might feel for that week that you're safe, but actually you're not. It's just that the test can only it's a snapshot in time, which is why certainly for lateral flow tests, we've always asked people to do them at least twice a week, if not more, or potentially every day. So therefore, even if you were able to have a PCR test once a week, that wouldn't necessarily, unfortunately, it isn't really a panacea. It isn't really the answer. And I think the answer is just being really, really vigilant around, symptoms. And then, obviously the moment you think anyone's symptomatic, absolutely get that PCR test. So the other thing I'm seeing a lot of is that people have symptoms and they take a lateral flow test and they think the lateral flow test is negative, therefore they're negative. So you should only be doing lateral flow tests if you don't have any symptoms. If you do have symptoms, you should be getting a PCR. And again, I would say, so for me, just to use a personal story, two of my children tested, had a positive PCR. I felt ill. I didn't have, I went and did a PCR and it was negative, but I just thought, I'm sorry, 2 of my kids have got a positive PCR and I'm not feeling good. I've got to have COVID. So then 2 days later, I did another PCR and then it tested positive. So I think as well with testing, it's like, go with your gut. If your circumstances and your logic, if your circumstances mean you've got a good chance of having COVID, don't just stop at one PCR if that's negative. If you continue to be symptomatic, go and have another one. And actually, Jenny, you're on the call, aren't you? You can probably answer this one loads better than me. I don't know where we stand around people who are asymptomatic accessing PCR tests. I know we were allowed to do it for a set amount of time as part of our extra things we were doing in Wakefield. I don't think that's now a possibility, is it, Jenny?
In general, as a district, no. However, there's no sense check on symptoms when you get for a PCR, so nobody's going to deny you a PCR. And if it's for the health and safety and well-being of a vulnerable child, I don't think anybody would turn you away. But as a general population, it obviously reduces capacity on those that really need it if we send everybody without symptoms. Does that make sense?
Yeah, great. And also I think the safety netting around that is that just because you've got a negative, just because you might get a negative PCR once a week, you shouldn't let your guard down, because it's not a guarantee that you're then negative for that whole week. So just to be a bit cautious around that. And I mean, I do think lateral, I mean, I was really, I've been really honest about my concerns around lateral flow tests, but I think, they can be really helpful, and they are worth doing, and they're just that extra precaution. So you know, although the same day that I had a positive PCR, I had a negative lateral flow, the day after my lateral flows went positive. And my children, it was quite a good, both of my children did a positive lateral flow and went on to do a positive PCR. So there is still some value in it, as long as it's, again, not seen as the be all and end all and the only thing. Yeah, I think
Thank
that's
you.
it.
Great answers.
Yeah.
Thank you, ladies. And the one in the middle was actually a request from one of our COVID champions to say they'd had an offer to display some Wakefield specific posters at a train station. And actually there may be some other places that we could promote some Wakefield specific. I'm not aware that we have any posters and leaflets that are specific around Wakefield, but maybe, George, if you're still on the call, is that something that we can pull together just really quickly, some Wakefield specific stuff? I think they're wanting it by next week.
Sorry, just 1 second. Sorry. Yeah, what are you wanting me to pull together for you? Just say again, sorry.
It's just a poster around some Wakefield specific advice for people who are using the trains. They've got quite a few people in that train station and they want some Wakefield specific stuff. So I'll be in touch with you after this meeting, George, to give you some information.
Right. Okay.
And we'll see.
How quickly would you need it though?
I think they're wanting it for next week, if that's doable.
I think we would struggle because it has to go through a process and then it has to go through creative and amendments. So right. to get it within a week, bearing in mind creative's workload, I doubt it. Okay,
but we can chat after the meeting. But thank you very much for that.
I can certainly look into it for you. Yeah.
Brilliant. Thank you very much. And then we had a last one, which was something on our WhatsApp group. I'm not sure that I totally understand the question, actually, so I can get back to the person who posted it. But they're trying to find the most up-to-date information for community organisations regarding providing information to track and trace. Is this something you can respond to, Jenny? Do we need a bit more information?
Yeah, I think more information in why the community group are contacting track and trace would be really helpful, if that's possible. I'm not sure I fully understand the content of the question to give a good enough answer.
That absolutely makes sense. Thank you very much. So thank you very much to all our speakers. I'm just going to have a quick look, see if there's anything in the chat. Oh, Helen Watkins has put some information about if people want to find out more about the health and care bill. There's some information on the website, which I will include. I'll pop that in the after meeting email. Sorry, Jenny, I interrupted you.
It's all right. I was just going to ask if the person who asked the last question was on call today.
I don't think she is.
Okay.
Doesn't look like she is, no. So we'll deal with that outside of the call. So thank you.
Can I just say regarding contact tracing, it's more for individuals than it is for groups.
Yeah.
It's not really geared up for group organisations. It's geared up to contact the individual that has come into contact with COVID-19 to identify whether or not they are positive, and any contacts they have, it's sort of a cascade of contacting people that are affected. It's not really for group organisations.
Absolutely, yeah. Without a bit more detail, it's difficult to answer that info, but we will find out more and answer that COVID champions question separately.
Yeah.
So thank you very much indeed to all of our speakers. Thank you, George, for that stop press bit of information there in the middle. Thank you to all our COVID champions for tuning in and listening and sharing that information. So we'll see you again in a fortnight.
Okay, I've emailed you, Tracy, regarding the news.
Brilliant. Thank you very much.
Okay.